Are you suffering from aches and pains that just won't go away no matter how hard you rub or stretch? Then perhaps it's time you visit a chiropractor.
So, a chiropractor is a healthcare professional who works on the management, treatment, diagnosis of various conditions affecting the neuromusculoskeletal system. What that means is we play particular focus on conditions related to nerves, muscles, and bones, with a particular focus on joint alignment and restoring optimal functionality in those joints. Major emphasis of our profession is with regards to manual therapies, which involves hands-on approach towards spinal manipulation and other joint and soft tissue manipulation to correct for orientation within the joint and ensuring there's optimal biomechanics. With regards to ailments, the most common and well-known ailments that are seen among the general population that are most known of amongst chiropractors is spinal-related disorders, which would be anything from the base of the skull, going all the way down to the lower back into the sacrum and coccygeal areas, which is around the gluteal area. That's the most well-known. However, chiropractors in South Africa do spend 6 years of studying with an extensive background in many other conditions, including that of the upper limb, the lower limb as well, going all the way from the shoulders to the fingertips, hips, knees, all the way down to toes. Anything musculoskeletal which involves the joints, muscles, tendons, ligaments can be treated by chiropractors. We also see a tremendous amount of results in areas such as whiplash, neck pain, the various types of headaches, scoliosis management, arthritis, and sports-related injuries, as well as those seen with our elderly patients and different forms of management for arthritis. So with regards to the effectiveness, if I can use this model of the spine for an example, what happens when we evaluate the spine, which is our primary concern, is we look at these joints along the side of the spine. And coming off the spine, we have all of these nerves which exit from these foramen which form between the joint spaces. If there is encroachment or entrapment of those nerves, that's where we get problems developing. Inflammation develops there, and the areas that are innervated or affected by those nerves start getting implicated. As a chiropractor, our main job is to evaluate each level going down the spine to make sure there is correct biomechanical functioning in each level, to ensure that there isn't that irritation and inflammation that's occurring at those vertebral levels. It's only with the direct pressure. We see a lot of the time where people have this misconception to say, I click my bones myself and can't I just do it on my own? What's very important to note in that aspect is the chiropractor does a very critical evaluation to determine within which direction the joint is fixated or restricted before performing that adjustment to reorientate the joint into its normal biomechanics. And what's also important to note is that we do not work on the premise of dislocation, and dislocation is out of our scope of practice. The ideas where people are afraid to think that you're popping my joints out of place, it's a complete misconception, and it's a prehistoric misunderstanding that's been there for many years now. So with regards to the topic of realignment, that's kind of a terminology that we try to avoid. What we do as chiropractors, particularly in South Africa and a lot of the countries around the world, we are trying to move more towards an evidence-based practice and a critical evaluation in a joint-by-joint system. What we then do is we evaluate critically each joint within its biomechanical function, and we aim to perform spinal manipulative therapies to ensure there's optimal biomechanics and mechanics within that joint and all the surrounding structures. South Africa in particular has 2 universities which have the chiropractic program, one in Johannesburg, one in Durban, and both are evidence-based have been setting out evidence-based professionals for the last couple of years. And the main concept with evidence-based practice is that we want to ensure that everything is reliable and everything is checked point by point, and there's optimal biomechanics and mechanical function in those joints.